Hello and welcome back to your therapy guide. I'm Dr. Yadegarfard. Today we are talking about something that often gets overlooked, yet is one of the most important skills in therapy and recovery: learning to notice and name what's happening in your body. In CBT, we often focus on thoughts, emotions, and behaviors, but underneath all of that is a foundation that influences everything you think and feel: your bodily sensations. Many clients tell me, I don't know what I'm feeling, or they confuse emotional or physical experiences. You might say, I feel sick, when what you actually feel is anxiety. Or my chest feels tight, and you worry it's your heart when it's actually fear or stress. Being able to name bodily sensation is as important as naming emotions or identifying unhelpful thoughts. It's a core part of understanding yourself, and it's also essential when practicing grounding or breathing exercises. So today we'll explore what bodily sensations really are, why they matter, and I'll guide you through short exercises to help you become more fluent in the language of your body. Every emotion you experience shows up somewhere in your body. Your brain constantly scans your internal environment, a process called interoception, to monitor things like heart rate, muscle tension, and temperature. These internal signals from the raw data that your brain uses to decide what emotion you're feeling. For example, when your heart races and your stomach flips, your brain might interpret that as anxiety or sometimes excitement. When your shoulder slumps or your energy drops, it might label that pattern as sadness. Or when your jaw tightens and your chest warms, that might register as anger. So before you even think a thought or feel an emotion, your body is already reacting and sending messages. Many of us were never taught how to describe what happens inside our bodies. We might have grown up in environments where emotions weren't discussed, or where physical feelings were either ignored or medicalized. So instead of, for example, saying I feel tension in my chest and heat in my face, we might jump straight to I'm having a panic attack, or we say I feel bad, which blends together sensations, emotion, and thoughts, making it hard to work with any of them effectively. In therapy and in recovery, one of our goals is to separate those layers so you can understand your experience more clearly. Let's practice tuning in. If it's comfortable and safe to do so, close your eyes or soften your gaze. Take a slow, deep breath in through your nose and out through your mouth. Now bring your attention to your feet. Notice any sensations there: warmth, coolness, pressure, tingling, or maybe nothing at all. Move your awareness up through your legs, your stomach, your chest, your shoulders, and your face. Don't try to change anything, just notice. Your body is speaking, you're simply listening. Let's make this distinction really clear. Bodily sensations are physical experiences: heaviness, tightness, warmth, tingling, tension, fluttering, restlessness. Emotions are the name we give to groups of those sensations: sadness, fear, joy, anger, calm. Thoughts are interpretations about those feelings: something's wrong, I can't handle it, I feel safe. For example, imagine you're about to give a presentation. You notice your heart racing and your palms sweating. That's the sensation. Your brain labels it, I'm anxious. That's the emotion. Then you think, I might mess this up. That's the thought. By breaking it down this way, you can begin to separate the facts of your body from the stories your mind creates. In CBT, you're learning to identify and challenge unhelpful thoughts, but if your body is overwhelmed, it's difficult to think clearly. Recognizing sensations give you early warning signs before your emotion escalates. It's like noticing the first rumbles of thunder before the storm hits. You might say, I'm feeling pressure in my chest and my jaw tightening. Maybe my anxiety is rising. That awareness lets you use a grounding technique or breathing exercises before panic takes over. The more precisely you can describe what your body is doing, the more control you gain over your reactions. Let's build your body awareness vocabulary. Take a breath in, and as you exhale, bring to mind one recent moment when you felt a strong emotion, maybe anxiety, anger, or sadness. Now, instead of naming the emotion, describe the physical sensations you remember. Was your body heavy or restless? Warm or cold? Tight or open? Still or shaky? Try using descriptive words. Pressure, fluttering, pulsing, tingling, hollowness, dryness, numbness, warmth. This is your body's vocabulary. It's a way of telling you what's happening inside. It's also common to mix up bodily sensation with illness or danger, especially when anxiety is involved. For example, a racing heart may be mistaken for a heart problem. Lightheadedness may feel like fainting, though it's caused by shallow breathing. A tense jaw or neck may feel like something's stuck. By learning to identify this sensation accurately, you reduce fear and prevent the anxiety spiral that comes from misinterpretation. You might reframe it by saying, my heart is racing. This is anxiety, not danger. It's my body preparing for action. If you practiced breathing exercises from previous episodes, you'll know that awareness of sensation is essential. You can't regulate what you can't feel. When you are aware of where tension sits in your body, you can direct your breath there intentionally. This turns breathing from a mechanical exercise into a self-compassionate practice. Let's try one more short practice. Take a slow breath in through your nose and exhale gently. Now, bring attention to your body once again. Choose one area where you feel the most sensation right now. Maybe your chest, your shoulders, or your stomach. Describe it silently. Is it tight, light, buzzing, warm, or still? Now, ask yourself, if this sensation had an emotion attached, what might it be? Does the heaviness feel like sadness? Does the fluttering feel like nervous anticipation? Does the warmth feel like calm or connection? There is no right answer. The goal is curiosity. You're learning to translate your body's language into emotional understanding. When you can identify sensation, you gain more precise awareness and more choice. You can pause before reacting. You can recognize when stress is building. You can tell the difference between fear and excitement, tension and anger, tiredness and sadness. And in therapy, this awareness makes your work more effective. Instead of saying, I don't know how I feel, you can say, I feel tightness in my throat and heaviness in my shoulders. Maybe that's anxiety. That small shift opens up new insight and direction for your recovery. Thank you for joining me on your therapy guide. If this episode helped you, please share it with someone who might benefit from learning the language of their own body. Don't forget to subscribe and follow me on social media. All the links are in the show notes. Until next time, take care of yourself, stay curious, and keep listening to your body. See you in the next episode.